Name of the module, Liaison Psychiatry, Part 1. Question number 1. A 30 years old female with history of bipolar affective disorder who is currently breastfeeding her child in the community has relapsed, but it doesn't warrant hospitalization. What would be the best medication for her in the community? A. Chloral hydrate, B. Lorazepam, C. Lithium, D. Lofipramine, E. Sodium valproate. It is important to avoid mood stabilizers at all in these circumstances. However, if there is a dire necessity, then the drug of choice would be sodium valproate. With regards to sodium valproate, it is important to monitor pediatric clinical status. It is also important to check for liver enzymes as it can cause deranged liver function tests. It is also important to check the platelet count because sodium valproate may induce thrombocytopenia. With regards to lithium, it is contraindicated during breastfeeding. 40 to 50% of maternal serum level is excreted in breast milk. Therefore, infant serum level can rise up to 200% of maternal serum concentration due to diminished renal clearance. Therefore, it can precipitate lithium toxicity in the child. Question number 1. The answer is E. Sodium valproate. Question number 2. Which antidepressant has the best evidence base for its use in post-MI depression? A. Paroxetine, B. Sertraline, C. Nortriptyline, D. Mirtazapine, E. Citalopram. This question has been taken from SAD Heart trial. SAD Heart refers to sertraline antidepressant heart attack randomized trial. So sertraline was studied against placebo. It was a 16-week trial. The observation was a non-significant reduction in the composite endpoint, which is MI or coronary heart disease death, was reported in the sertraline group. Therefore, SSRIs may be directly cardioprotective by reducing platelet activation. After 24 weeks of treatment, the effect of sertraline was greater in the patients with severe and recurrent depression. Therefore, the answer for question number 2 is sertraline B. This antidepressant has the best evidence base for its use in post-MI depression. Question number 3. Which of the following is most common in delirium? A. Hallucinations, B. Delusions, C. Disturbed sleep-wake cycle, D. Labile mood, E. Increased motor activity. Disturbed sleep-wake cycle is the most common symptom reported in patients who have delirium, and disturbed sleep-wake cycle has been reported in nearly 98% in a study. So it is almost always disturbed in someone who has delirium. Therefore, the answer for question number 3 is C. Disturbed sleep-wake cycle. Question number 4. All are true about delirium in palliative care except A. It occurs in over 50% of patients at some stage in their illness. This is true because delirium is something that is common in patients who are receiving palliative care. B. May present with sedation. That is true. There are two types of delirium. One is called as hyperactive delirium, where patients are agitated and disturbed. The other one is hypoactive delirium, where the patient may become lethargic and also sedated. So B is also true. C. always responds to neuroleptics. That is a wrong answer. Sometimes it responds to neuroleptics, particularly low dose of haloperidol, but it doesn't always respond to neuroleptics. D may be irreversible. That is true. Sometimes it can become progressive and also irreversible. E, multifactorial in origin. That is also a true statement. In most of the situations, often there are multiple factors involved for someone to develop delirium, and sometimes the causes are not ascertained accurately. So all statements are true except statement C, always responds to neuroleptics. Question number 5. In England, the proportion of preventable suicides according to mental health professionals is A 1 in 4, B 1 in 10, C 1 in 2, D 1 in 7, E 1 in 9. If you look at the inpatient suicide statistics, the number of inpatient suicide that occurs in the first week is about 25%, and this is considered to be a preventable suicide. Therefore, the preventable suicide ratio is 22%. That's the inpatient suicide occurring in the first week. And the strongest risk factor for suicide is past history of deliberate self-harm. So question number 5, the answer is A, 1 in 4, which is 25%. Question number 6, in patients with hepatic insufficiency, the best option available to prevent delirium tremens is A, clonazepam, B, chlordiazepoxide, C, carbamazepine, D, oxazepam, E, clonidine. Oxazepam, temazepam, and lorazepam are 3 important drugs which undergoes phase 2 metabolism in the liver directly. So we can use these 3 drugs for patients with hepatic insufficiency such as alcoholic cirrhosis, hepatitis, etc. The answer is D, oxazepam. So oxazepam is helpful to prevent delirium tremens. Question number 7. Which of the following MRI finding is characteristically seen in Huntington's disease? A, caudate atrophy, B, cerebellar atrophy, C, multiple white matter hyperintensities, D, pulvinar infarct, E, knife blade gyri. So if you look at the MRI picture here, you can find the caudate nucleus on both sides as well as the putamen nucleus. Okay, so in patients who have Huntington's disease, there is caudate atrophy on both sides. Therefore, the ventricles can become really enlarged. So caudate atrophy and enlarged ventricles are seen in Huntington's disease. It's also called as boxcar ventricles. So answer for question number 7 is A, caudate atrophy is characteristically seen in Huntington's disease. If we look at other options, cerebellar atrophy is seen in CJD. Multiple white matter hyperintensities are seen in vascular depression, particularly in older adults. Pulvinar infarct is seen in variant CJD. Knife blade gyri is seen in Pick's disease, which is frontotemporal dementia. But the answer for 7 is caudate atrophy, which is characteristically seen in Huntington's disease. Answer is A. Question number 8. The risk of suicide 1 year after self-harming is A, 0.7%, B, 2.5%, C, 4%, D, 6%, E, 3%. Let us look into the risk of suicide 1 year after self-harming. The figure is 1 in 100. 1 out of 100 people commit suicide 1 year after self-harming. Out of this, 1.1% is males, 0.5% in females. If you take the average of both, it's about 0.7%. Therefore, the overall risk of suicide 1 year after self-harming is a 0.7%. Question number 9. What is the most likely site of the primary tumor which, when metastatic, could cause symptoms of peripheral neuropathy and memory loss? A. Kidney, B. Lungs, C. Liver, D. Brain, E. Intestine. Carcinoid tumors can mainly affect the small intestine, particularly ileum. When the person presents with carcinoid tumors, then their niacin is used for production of serotonin and bradykinins in the body. When the niacin is used for this purpose, then obviously it leads to low nicotinic acid levels in the body. When the nicotinic acid level goes down, then the person can develop pellagra. When the person has got pellagra, they can develop dermatitis, they can develop diarrhea, and also dementia. Therefore, the correct answer is intestine. So if intestine is the likely site of the primary tumor, when there is metastasis, it could cause symptoms of peripheral neuropathy and memory loss. Answer is E. Question number 10. In Korsakoff syndrome, the type of memory that is most affected is A. Episodic memory, B. Semantic memory, C. Working memory, D. Procedural memory, E. Implicit memory. Korsakoff syndrome occurs in patients who are chronic alcoholics. It occurs due to thiamine deficiency in alcoholics. It manifests with psychosis, memory loss, and also confabulation. Korsakoff syndrome is distinguished from acute Wernicke's encephalopathy by the person having prominent anterograde as well as retrograde amnesia without substantially impaired alertness and attention or extraocular movement disturbance. In Wernicke's encephalopathy, the person may have problems with attention, they may not be alert, they may be confused, and they may also have extraocular movement. But in Korsakoff syndrome, these are not present, but the person may have prominent anterograde and retrograde amnesia. So the answer for question number 10 is episodic memory. So episodic memory includes both anterograde as well as retrograde amnesia. So the type of memory that is most affected in Korsakoff syndrome is episodic memory. Answer is A. Question number 11. What is the risk of depression in a cardiac patient with congestive heart failure compared to the general population? A. 1:5, B. 5:1, C. 3:1, D. 1:2, E. 10:1. The overall prevalence of a depressive disorder is 6 to 7%. But for cardiac patients with congestive heart failure, this risk increases to 21.5% according to meta-analytic studies. Risk is increased by 2 to 3 times. 7 into 3 is 21. Therefore, the risk is increased 2 to 3 times. Therefore, the answer for question number 11 is C, 3:1. The risk is increased by 3 times. Question number 12. Which of the following symptoms do you see more often in the later stages of HIV dementia? A. Depression, B. Agitation, C. Paraparesis, D. Apathy, E. Ataxia. HIV encephalopathy is also called as AIDS dementia complex. Later stages of HIV dementia, they can develop global cognitive impairment, delayed verbal response, vacant stare, spastic paraparesis. Paraparesis is paralysis of lower extremities. And they can also develop hyperreflexia, psychosis, tremor, hallucinations, incontinence, and seizures. So, among the options given here, paraparesis is more often seen in the later stages, but apathy, ataxia, agitation, and depression are seen in the more early stages of HIV dementia. Question number 12, answer is C. Question number 13. The most common psychiatric symptom in Cushing syndrome is A. Mania, B. Depression, C. Psychosis, D. Anxiety, E. Memory loss. In patients with Cushing syndrome, psychiatric effects are very common, particularly depression is extremely common. 50 to 80% of patients who have Cushing syndrome develop depression, and this has been reported even in earliest case descriptions. Therefore, the answer for question number 13 is B. Depression. Question number 14. Which of the following is a characteristic symptom of hepatic encephalopathy? A. Asterixis, B. Ataxia, C. Tremors, D. Neck rigidity, E. Visual hallucinations. Asterixis is a characteristic symptom which is seen in hepatic encephalopathy. In asterixis, the patient's wrists and fingers are observed to flap because of a brief, rapid relaxation of wrist dorsiflexion. That's a characteristic symptom seen in hepatic encephalopathy. So answer for question number 14 is A. Asterixis. Question number 15. Which of the following points towards dissociative pseudoseizures rather than epileptic seizures? A. Presence of automatisms. Automatisms refers to spontaneous verbal and motor behavior which are performed unconsciously. These are seen in people who have epileptic seizures. B. Total duration being less than 30 seconds. So in dissociative seizures, usually the duration of seizures are quite prolonged. C. Presence of open eyes during seizures. That is false. Open eyes are seen in true seizures, but in pseudo seizures, the eyes may be kept shut. D. Physiological progression of seizure. That is seen in true seizures, but not in pseudo seizures. E. Side-to-side movements of head. So side-to-side movements of head is a feature of dissociative seizures. When there is side-to-side movement of head, they are less likely to sustain injuries. The dissociative seizures are more likely to happen in the daytime and when others are present, and patients are also less likely to sustain injury from seizures. Often they may have past psychiatric history and they may express their distress in a physical way. In many cases, social stressors like abuse in childhood is also commonly seen. So question number 15, the correct answer is E. Side-to-side movements of head points towards dissociative seizures rather than epileptic seizures. Question number 16. Which of the following is an effective treatment for post-stroke depression based on the best available evidence? A. Fluoxetine, B. Mirtazapine, C. Venlafaxine, D. Amitriptyline, E. Duloxetine. Post-stroke depression is a common problem seen in at least 30 to 40% of survivors of intracerebral hemorrhage. The drugs which are recommended for post-stroke depression include SSRIs like fluoxetine and tricyclics like nortriptyline. Therefore, for question number 16, the answer is A. Fluoxetine. Question number 17. Which of the following tremors increase during intentional movement? A. Drug-induced tremors. B. Resting tremor. C. Parkinsonism. D. Myoclonic jerks. E. Cerebellar tremor. Cerebellar tremors can affect the upper limbs, head and trunk. When they involve the upper limbs, they are action and kinetic tremors which occurs during movement. The amplitude of these tremors increases on approaching target during goal-directed movement. So for question number 17, the correct answer is E. Cerebellar tremor. These type of tremors increase during intentional movement. Drug-induced tremors are resting tremors. Question number 18. What would be the most appropriate drug for a depressed lady who is pregnant? A. Paroxetine. B. Sertraline. C. Fluoxetine. D. Citalopram. E. Venlafaxine. In terms of depressed pregnant ladies, there is a lot of evidence available for fluoxetine as it is considered to be a safer drug. Therefore, fluoxetine is recommended primarily. The other drugs which are recommended include amitriptyline, nortriptyline, and also imipramine. Therefore, the answer for question number 18 is C. Fluoxetine. That would be the most appropriate drug for a depressed lady who is pregnant. Question number 19. What is the most suitable drug for a depressed palliative care patient suffering with nausea and vomiting following chemotherapy? A. Duloxetine. B. Reboxetine. C. Fluoxamine. D. Mirtazapine. E. Escitalopram. If you look at mirtazapine, mirtazapine is a serotonergic and noradrenergic antidepressant, but it also has 5-HT3 antagonistic properties, which means it does not induce nausea, and that is not a side effect reported with mirtazapine. So this patient is already suffering from nausea and vomiting following chemotherapy. Therefore, in this case, mirtazapine could be used. The answer for 19 is D. Mirtazapine. 20. The prevalence of somatoform pain disorder is A. 7%, B. 17%, C. 27%, D. 37%, E. 47%. According to a Belgian study, depression is the most common prevalent psychiatric disorder, followed by anxiety disorders. Then, third prevalent psychiatric disorder is somatization disorder, which is reported in 8.9% of people in a Belgian study. The closest answer to 8.9 is 7%, and therefore the answer is A. 7%. 21. A 45-year-old diabetic gentleman was brought to A&E with nausea, vomiting, lethargy, and muscle cramps. He has been diagnosed with depression and has been started on fluoxetine recently. What is the most likely metabolic complication? A. Hypercalcemia. B. Hypocalcemia. C. Hyperkalemia. D. Hypokalemia. E. Hyponatremia. If you look at the features of hyponatremia, it includes nausea and vomiting, headache, lethargy, muscle weakness and muscular cramps. In severe cases, the patient may develop confusion, seizures, and also coma. Hyponatremia is reported with all antidepressants, especially SSRIs. And among the SSRIs, fluoxetine has the highest propensity for people to develop hyponatremia. The answer for question number 21 is E. Hyponatremia, as he is now presenting with nausea, vomiting, lethargy, and muscle cramps. These are all features of hyponatremia, and it is also often seen with people who are taking fluoxetine. 21 answer is E. 22. What percentage of women with postpartum psychosis will go on to develop schizophrenia later in their lifetime? A. 15%, B. 25%, C. 50%, D. 75%, E. 100%. If you look into long-term studies of people who have postpartum psychosis, most of them have received a diagnosis of affective disorder in the long term. 16% went on to develop schizophrenia, and among them 50% of patients also had chronic disability. The closest answer for 16 is 15, therefore please mark A, 15%. So 15% of women with postpartum psychosis will go on to develop schizophrenia later in their lifetime. Question number 23. Which of the following is neonatal complication seen in babies who were born to mothers prescribed lithium during their pregnancy? A. Neonatal goiter, B. Tetany, C. Cushing syndrome, D. Anencephaly, E. Floppy baby. When mothers took lithium during pregnancy, there are a number of neonatal complications reported, which includes Epstein's anomaly, neonatal goiter in the child, ventricular septal defect, atrial septal defect, cardiac arrhythmias, and also hypotonia. Among the options here, the one that is correct is neonatal goiter. Neonatal goiter is a neonatal complication which occurs in babies who were born to mothers prescribed lithium during pregnancy. So answer for 23 is A. 24. A 29-year-old woman who is 6 months pregnant is referred to your clinic for an opinion. She is depressed, has a previous history of depression and a family history of depression. She has responded well to paroxetine in the past. If she were to continue with paroxetine throughout pregnancy, which of the following is most likely to be seen in her baby when it is born? A. Neural tube defects, B. Facial abnormalities, C. Irritability, D. Epstein's anomaly, E. Neonatal bleeding. When SSRIs are used during pregnancy, there is no increase in major malformation reported except for paroxetine. Paroxetine, particularly when used on high doses during first trimester, is clearly linked to cardiac malformation like VSD and ASD. Exposure to SSRI, particularly when taken in late pregnancy, may increase risk of persistent pulmonary hypertension of the newborn, although the absolute risk is small. Third trimester use of SSRIs can give rise to neonatal complications like irritability due to abrupt withdrawals. So neonatal complications like irritability are common due to abrupt withdrawals when SSRIs are used in the third trimester. Therefore, the answer for question number 24 is C, irritability, which is a withdrawal symptom seen in newborn when paroxetine was taken throughout pregnancy. Question number 25. Which of the following investigatory findings is most supportive of a diagnosis of Huntington's disease? A. Raised white cell count on lumbar puncture. This is not a finding seen in people with Huntington's disease. B. MRI scan shows atrophy of the head of the caudate nucleus. Atrophy of the caudate nucleus is reported in people with Huntington's disease. C. EEG shows spike and wave activity. That is false. In fact, EEG shows flattened traces in later stages of Huntington's disease. HMPAO SPECT scan shows patchy hypoperfusion throughout the brain scan. That is not correct. E26CAG repeats on DNA analysis is seen. That is false. It is 26CGG repeats on DNA analysis. So 25 answer is B. MRI scan shows atrophy of head of the caudate nucleus in people with Huntington's disease. 26. In countries with low suicide rates, what is the lifetime risk of suicide in people who are alcohol dependent? A. 1%, B. 2.5%, C. 5%, D. 7.5%, E. 10%. Alcohol is an important risk factor for suicide. In countries with low suicide rates, the lifetime risk of suicide in outpatients who are alcohol dependent is 2.2%. In countries with low suicide rate, the lifetime risk of suicide in inpatients who are alcohol dependent is about 3.4%. So if you take the average value of both, it's about 2.5%. So that should be marked as a correct answer. So answer for 26 is B, 2.5%. 27. A 75-year-old man with a history of vascular dementia complains of drooping of the corner of the mouth and difficulty closing his left eye. He is able to frown. Which cranial nerve palsy is more likely to present in this way? A. Oculomotor nerve palsy, B. Facial nerve palsy, upper motor neuron type, C. Facial nerve palsy, lower motor neuron type, D. Trigeminal nerve palsy, sensory type, E. Trigeminal nerve palsy, motor type. So in people with Bell's palsy, they may have upper motor neuron lesion or lower motor neuron lesion. If there is element lesion, then both upper and lower facial weakness on the same side is present. If they have upper motor neuron lesion, then lower part of the face on the contralateral side will be affected, but upper part of the face will be spared. If you look at the scenario, the person complained of drooping of the corner of the mouth and difficulty closing his left eye. He is able to frown. The upper part of the face is spared, only lower part of the face is affected. This is upper motor neuron lesion. Therefore, the answer for question number 27 is B, facial nerve palsy, upper motor neuron lesion. Question number 28. A 33-year-old man with history of schizophrenia has moderately severe renal failure. Which of the following drugs undergoes significant renal excretion? A. Amisulpride, B. Aripiprazole, C. Olanzapine, D. Risperidone, E. Chlorpromazine. Amisulpride is primarily renally excreted, so it is best avoided in patients with renal impairment and renal failure. Therefore, the answer for question number 28 is A. Amisulpride. 29. Which one of the following medications would be used to treat pathological crying? A. Venlafaxine, B. Citalopram, C. Mirtazapine, D. Imipramine, E. Reboxetine. Pathological laughing and crying syndrome. It is also called as emotional incontinence or pseudo-bulbar affect. Here, the person is involved in spontaneous, unprovoked laughter or crying, which is often seen in patients who have brain damage. It occurs in response to non-specific stimuli, in the absence of associated mood change, and in the absence of voluntary control of facial expression. The affect change is generally transient, but it can be distressing due to perceived loss of control. The drugs which are mainly used for pathological laughing and crying syndrome are low dose of amitriptyline, SSRIs like fluoxetine, sertraline, and citalopram. Among the list of options, citalopram is recommended and can be used to treat pathological crying. Answer for 29 is B, citalopram. Question number 30. A 33-year-old woman has been referred by the dentist with a long history of facial tingling, numbness, nausea, and temporomandibular joint pain. The pain tends to fluctuate and they were anatomically inconsistent. Further investigations have shown no abnormality. The most likely diagnosis would be A. Hypochondriasis, B. Anxiety disorder, C. Somatoform disorder, D. Delusional disorder, E. Depressive disorder with hypochondriacal delusions. In people who have somatoform disorder, chronic pain will be the main focus. And the pain is usually not caused by any physical reasons, and psychological factors play an important role in the onset, severity, and exacerbation of symptoms. If you look at this scenario, this woman's pain tends to fluctuate and they were also anatomically inconsistent. Investigations have shown no abnormality. All these are suggestive of somatoform disorder. Therefore, answer for question number 30 is C, somatoform disorder.